Hello everyone, my name is Dr. Harsh Mittal. I'm currently an intern in the Loknayak Hospital. So in this video, I'm going to tell you about give you a format for a near ideal case of obstetrics. So me and my friends prepared this while we were preparing for the final year practical exams. So I hope this will help you. So I'll start with the basic format in which there is uh, details about the patient. So a lot of professors ask many different things, so I've added everything. So you can read it up, and I'll just explain some important points. So in this, the demographic data, LMP, EDD and POG are very important. After saying this, you need to tell about the reliability of dates, excellent, good or poor, according to the USG. Then you need to say gravida para and mention the blood group, especially if the mother is Rh negative. Otherwise it will be okay. Then you need to say if there is any chief complaint. Usually when cases are given in the exams, they are usually admitted due to some chief complaint, or if they are near term. Otherwise, if you are given a case in OPD, it could be due to regular checkup. So you can say that the lady has came for a regular checkup during the pregnancy. Uh, After that, if most likely when you will be giving exams, there will be a complaint. So you need to explain the history of presenting illness. After history of presenting illness, you will start with the trimester wise history. In the trimester wise history, there are a lot of points to be covered. So firstly, it will be better if you go in order, like you start with the spontaneous conception or ART, then how was the pregnancy confirmed, then when was the first visit, and mention number of visits in every trimester. Okay. Then tell about the drug intake, if she took the TD injection, USG first level was done or not. Then you start with the complaints about diseases related to the first trimester. So nausea, vomiting due to hyperemesis gravidarum, and radiation exposure and chronic drug intake which can be teratogenic in the first trimester. As well as you will ask about discharge PV, fever, rash and bleed PV. These things can indicate towards abortion or any other complication. Also there is burning micturition and cardiac discharge for UTI. Then second trimester. In second trimester, again you'll start with the ANC visits, and then next point should be quickening. Quickening is very important for the second trimester because it usually starts in second trimester. So if there is it's primary, it starts at 18 weeks, and if it's multigravida, then it starts at 16 weeks. Then you will ask about level 2 USG, and you can ask them if it was normal or not. They usually know it is. Then if TD second was given, drug intake, fever, rash, discharge again. Then in second trimester, there is history of PIH. PIH history becomes very important because disease can begin from second trimester. So you will ask about the history of PIH, in which you will ask epigastric pain, blurring of vision and headache. Then you will ask if DIPSI was done. DIPSI for GDM. Then hypothyroid symptoms, if they are there or not. Then in third trimester, number of ANC visits. Then in third trimester, daily fetal movement count should be asked. Okay, and you should know how to ask a lady for daily fetal movement count. Like खाने के बाद 2 घंटे एक तरफ करवट करके लेटना होता है और पेपर को फाड़ना होता है, और तो जितनी बार फाड़ दोगे तो उतना काउंट हो जाता है. ठीक है. फिर लेवल 3 USG, इट्स नॉट डन इन एवरी पेशेंट, मतलब इट कैन बी डन. सो इफ there is a level 3 USG, you can tell about it. And then you will ask about bleed PV, leak PV, PIH and GDM, and labor pains too, because it's near term. Third trimester is near the term. Then you will ask about menstrual history. Menstrual history डिटेल से पता होनी चाहिए. उसके बाद marital history भी important है in case of consanguinity. Then you need to tell about the obstetric history. In obstetric history, you need to tell about each and every conception she had ever had. So you need to tell about the baby that were born, in which you will tell about how they were conceived, when, at what POG they were born, how the baby was delivered, where the baby was delivered, if health of baby was normal after that, and if any complication occurred during birth or after birth in both child and mother. And you need to tell this about every child. Also, in case of abortion, you need to tell about when the baby was aborted and how the baby was aborted. After that, you will tell about the contraception history. In contraception history, you need to tell about what kind of contraception they were using, if they were using or not, and that's it. Then past personal and family history you know very well, and then nutritional history. In that, it becomes very important in cases of GDM and anemia. In GDM, you need to tell about the calorie excess and deficit. Also, you need to tell about the protein excess and deficit. While in anemia, you need like, if you can remember, then you need to tell about if the dietary iron is okay or not. Like, it's a bit too much to ask according to me, but okay. So after you have finished with the history, you can either tell a little summary about the history, or you can move on to the examination. So in examination, first you will tell about, like, patient was examined in a well lit room with proper consent taken, and if you are male, then you need to say that it was done in presence of a female attendant. After that, you will start with the built pickle vitals. Then you will do the examination of breast and thyroid, so don't forget about this. Although if you forget, most people won't care about it, but just mention it. It will be very impressive for the examiner. After that, we will start with the abdominal examination. So in abdominal examination, you need to say that the bladder was emptied, and you need to tell about the exposure. Then in the position, you need to flex the legs. Don't forget to flex the legs. Okay. After that, we start with the inspection. So you will start with that distended abdomen, moving with the respiration, skin changes, dilated veins, hernial site free or not. Then you will start with the palpation. Palpation may tenderness, temperature. Then you will start with the fundal height. During fundal height, don't forget to correct the dexter rotation with the right hand. Fundal height is done with the ulnar aspect of the hand. Okay. Then symphyso-fundal height. Don't confuse such stuff. Okay. In some fundal height, you measure it in centimeter, and you measure it after straightening the legs. Don't measure it while the legs are flexed. Okay. So while measuring the symphyso-fundal height, keep the inch side above, so that there is no bias, and examiner will see if you are doing it in this way only. So be careful about this. Also, some people ask to mark the fundal height, so you can mark it too. And in abdominal girth, you need to measure it in inches. While measuring, you need to keep the centimeter side above. After that, you need to do the grips. Grips are mostly easy, and in lateral grip, if you are not very confident about which side is which, you can listen to the fetal heart sounds to confirm it, if you know how to listen to the fetal heart sounds. Also, if you are not able to hear the fetal heart sounds, and you know where the back is and where the head is, then you can easily know where the fetal heart sounds should be situated, and you can just put a cross there, and examiners also see if you have put a cross, because that's important. Okay. After that, most of the examination is done. Yes, so then you will do the you can also mention the systemic examination. Obviously you will mention the systemic examination, and then you will tell about the summary of the whole case, like my patient Rashmi 34. There is no Rashmi, this is an imaginary case. My patient Rashmi 34-year-old G2P1 L1 in 38 weeks POG with single live intrauterine fetus in longitudinal lie and cephalic presentation is a case of GDM, for example. And if you are mentioning a disease, then you need to mention about if treatment is going on or not, and if the control is there or not. For example, in GDM, if the patient is on MNT or insulin or oral hypoglycemics, or and if the GDM is controlled or not. That's it. Thank you. All the best. One last thing. This video will be great for final year students, so I hope this will help. But if you are in third and second year, and even if you are in the final year, currently no exam is not near. So अभी से अगर तुम इस फॉर्मेट को यूज़ करोगे तो फॉर्मेट एक्सप्लेन करने में टीचर का टाइम वेस्ट नहीं होगा. सो यू विल बी एबल टू focus on better things like understanding the subject, understanding the topics, and what all questions the teachers can ask. Because अगर तुम्हारा format correct होता है तो फिर they will ask other questions which are asked in the viva. So I suggest that you will use this format starting from the second year. Okay, all the best.